You are a patient having a gynecological issue and you want to decide where to go and whom to talk to. A very common scenario, and sometimes it's a very sad scenario for me as a gynecologist, because everyone has good intentions. I really believe in humanity. I really believe that we had an oath to help our patient do no harm and to help everyone. Sometimes I don't know what happens after that. I am not sure. I'm hoping that people are good in their heart and they're trying to do their best. But sometimes, as a surgeon, your ego, finances, other factors, unconsciously unconscious of your mistake, meaning you're not aware that you're not good, uh, uh, or you're different reasons. I'm not sure, and it's not the purpose of this video, but I have seen good and bad scenarios for my patients. Let's talk about the good first, because let's stay positive. The goods. The patient are coming to me with an issue referred by your amazing gynecologist because it's beyond their expertise for the case. I love those physicians. I sometimes just want to go and give them a big hug because they did not let anything compromise their judgment to compromise the patient's care. If they think, you know what, there is a patient, a person, a physician out there in my community or the surrounding communities that can do this better for my patient, let me send the patient to that person. What is that? What is better than that? That good deed, that good action, that great humanity. It's our job. It's our job. We forget. We took an oath to help our patients. And the problem is patients don't know. You're an OBGYN, you're an OBGYN. They don't know who's good, who's bad, how many cases have you've done. Patients don't know. They come to me, if they hear my video like this, they think I'm excellent. Well, I am excellent. But they, maybe there's another person through social media or through a friend or the doctor that delivered their baby from 20 years ago. They think, because there's lack of awareness, patient think OBGYN is OBGYN. So purpose of these videos again is to raise your awareness as a patient. You have to do your research, you have to educate yourself, and I am going to help you through this process. A lot of my amazing colleagues are doing the same. So just research enough, listen to more people, and Dr. Google, I'm not sure, because Dr. Google sometimes gives you wrong information or leads to anxiety or just not what it's supposed to be. Because you're putting something and the Dr. Google will just tell you the search for what you put in. So not necessarily the answer of your real issue. You get that? So let's say one of those good scenarios, a physician of a friend, amazing physician in my community, Jeannie, doing OBGYN full spectrum, and saw a patient with a 15-week size uterus. Once we have fibroids, we measure it with weeks. We can measure it with centimeters, but why we measure it with weeks? Because we can put our hand on the top of the fundus of the uterus, as we do for pregnant uterus, and call it weeks. So because we're used to do that for obstetric, we're using the same knowledge or the same kind of language for uterine fibroids and bulky uterus. So let's say 14-week size uterus, meaning approximately 14-week size, 10 to 15 size centimeter size fibroid. They know, general OBGYN, unless if they have done through the learning, through the error, through the years, still they will not be, I guarantee by nature of training, they will not be at the expert level of a person that did a fellowship or two. Just a fact. It's a fact. It's like flying a commercial airplane versus a little private airplane versus a military jet. There's a huge difference. There's a huge difference. It doesn't mean that I'm a pilot, that I can fly all of them. Absolutely not. Absolutely not. So it's the same idea in medicine. It does not mean that you're seeing your OBGYN, that your OBGYN can do the commercial airline flights or the military ones, even more complicated. So do your research and educate yourself. So general OBGYN, I'm not saying everyone is the same. Some people are expert, not common, but most are comfortable with easy to moderate easy cases, right? Anything with stage 3 to 4 endometriosis, excision of endometriosis, bulky fibroids, definitely any malignancy, definitely any pelvic floor prolapse. No, they just don't have the training. They do not have the training. And even if they learn somehow the skills through the years, I'm not really sure where did they come up with these skills. Learning from a YouTube is different than learning from a fellowship, with all due respect. But they're amazing in doing what they're doing on a daily basis to take care of you, to save your life, to deliver your baby, and to deal with your general OB/GYN issues. Abnormal bleeding, pap smears, IUDs, menopause, all that general, amazing, basic topics that is under the scope of the general OB/GYN that will keep them busy without needing to do complicated cases, right? So ideally, they will advise you that they will see you, obviously, because most patients don't know. So you'll go with your issue, your fibroids, to your OB/GYN. And if they have good ethics, and if they love you, and if they provide good care to their community, and they are good servants to their community, and they are good human beings, they will say, you know what, I could do your case. I could, but there is a physician in the community that I'm going to send you to that is doing it better than me, because they're trained to do that and they have larger number of cases. In our world, it's like flying. You have to have more than 10,000 hour of flying, or that common philosophy of 10,000 hour of doing whatever you're doing to be excellent at. So it applies the same with surgery. Number of cases kind of equivalent to how many hours. I cannot be doing 5,000 cases and have less than 10,000 hours of uh, cases or practice under my belt. It goes hand to hand. So they will refer you. We're happy to see you, and then we will see you for a consult and address the issue, and go through the pros and cons of what you have, and then discuss the options and go from there. Some patients will need surgery still. Some patients will not need surgery and they need observation. But let's talk about the bad scenario. Oh, yes, you have fibroids. I'm going to take you to the operating room. How are you going to do my fibroids, doctor? Oh, I have to cut you open. It's a big uterus. It cannot come through small incisions. It's a big uterus. It's a big mass. I need to take you to the operating room. You, as a patient, trusting this OBGYN. Okay, doctor, I trust you. Common, right? Very common. Common sense, common practice. That's why in the US alone, more than 60% of hysterectomies are still done open. So unfair. If I have a goal in life and a message to deliver and a change, an impact to change, would be that, would be changing that to less than 10% or less than even 5% open hysterectomies for benign cases. But we can do that even for malignant cases as well, if it's limited, if it's not spread, not metastasized. So if your doctor is saying open, run away, or have a second opinion, please, or third opinion, or fourth opinion. It matters because it's not only how they do the surgery, it's not only opening you up, it's the experience level, the possible higher risk of complication, admission to the hospital that you don't need, pain. Who loves pain? Who loves pain? Do you want to be in pain? No. So the pain that you're gonna have for weeks, not being able to not only not work, okay, not going to work is okay, but not being able to be good to yourself, good to your family, travel, enjoy yourself in pain for 6 weeks. And then also with a bigger incision, the fascia of the abdominal wall does not heal very well, especially if you have other factors like obesity, diabetes, and stuff like that. So there's a higher chance of hernia, which is the inside doesn't close. The skin is closed, the inside doesn't close. So it really leads to bigger abdomen, protrusion, pain, disaster. And you need a second surgery and the third surgery. It's just not the same. So please, please, for you, my dear patient, do your research, educate yourself, reach out to us, mm, subscribe to me and all my colleagues that are trying to do the same and achieve the same goal into elevating women's health, empowering you, and improving your life.